60 degrees for the last several hours. Now with the sun up, temps are going to start to climb. That along with a gusty south to southwest wind. And we've got a warming up day today. Highs this afternoon making it into the upper 70s later today. Up close to 80 today. And for the next several days, we'll show you that extended outlook in just a few minutes.
All right, Glenn, sounds good. What sounds like science fiction could one day be science fact. We're talking about new hope for those paralyzed to be able to walk again. Frank Reynolds is the CEO of a company called In Vivo Therapeutics. Frank, thanks for coming in.
Thank you for having us.
Your hope is to help get people out of their wheelchairs, and you say that you can possibly do it with what you have right here. Explain it to us.
Yeah, sure. So there's different types of spinal cord injuries, and each injury will have its own technology to treat it. But there may be a scaffold used, there may be an injectable gel used that releases drugs, there may be a scaffold used with stem cells. For the patients that are in wheelchairs right now, they're definitely going to need a scaffold just like this with stem cells. And we actually have a video of one of our monkeys that we did paralyze and then treat with a scaffold and human neural stem cells. You can see this monkey was paralyzed 2 days before this video was taken. And then at the time of injury, we did implant our scaffold and human neural stem cells. And it was amazing to see them up and running in just a couple of weeks. So in history, people paralyze monkeys, treat them. You wouldn't even get involuntary movement like twitching, and we have them up and walking in just a few weeks. So the next video that we play should have the video of the monkey up and walking. It's actually 5 weeks. This is just 5 weeks after treatment. It is quite remarkable. And again, there's a range of different types of injuries and a range of technologies required, and we've invented all of them at In Vivo. So,
what kind of spinal cord injury did that monkey have?
That's called a hemisection. That's where we literally remove 50%. You can see we paralyze that left leg, and there he is lifting his left leg and controlling it just weeks later. So it's called a hemisection injury. It's the only injury you can do to a monkey to really keep it alive.
Well, if it works in monkeys, what's preventing it from being as successful in humans?
Well, we think it will be, actually. We're at the FDA right now. We're meeting with the FDA in April and hoping to start humans in June. So we're pretty excited to get those studies started.
Question from one of our emailers. A viewer emailed us saying, quote, the spinal cord injury community really needs a cure for chronic spinal cord injuries, not acute injuries, as acute injuries can turn into chronic injuries, end quote. Why is that a big differentiation?
Yeah, so actually it's interesting that 90% of patients who arrive in the emergency room are not paralyzed for life. 90% are then going to experience bleeding and inflammation over the first 3 weeks after injury. That results in scarring. That puts them in a wheelchair for life. That makes them chronic. So with our first technology at the FDA right now for the acute population, it would actually prevent that scarring and hopefully prevent them from being as bad as they could be as chronic patients. A chronic patient, of course, is somebody past the 30-day mark after injury where scarring has already set in, and that creates another set of challenges, which is why we've developed a scaffold, combining it with human neural stem cells to then surgically remove their scar tissue, implant our scaffold with the human neural cells, creating that regeneration that's required for the chronic injury.
So you go ahead, I'm sorry. Go ahead.
So chronic injuries require regeneration, and acute injuries require neuroprotection. So we're trying to protect the tissue from scarring to begin with. So the acute injuries are neuroprotection. We have technologies for that. And then the chronic injuries require regeneration, and we have technologies for that also.
Nuts and bolts here. I mean, you've got the little are you saying scaffold?
Yes, scaffold. Just like a scaffold that supports a house, yeah.
All right.
So we support the spinal cord itself with scaffolding structure, just like you'd support a house with scaffolding.
So like where would you put it on this piece right here?
Actually, in here, you would actually implant it right into the spinal cord itself, right between the bones. It's interesting. 90% of the patients, again, don't have to be in wheelchairs for life, but all of them are going to receive screws and rods. So during a surgery where they're going to remove this bone, exposing the spinal cord and put in screws and rods, we're simply going to implant our technology right into the cord itself.
And does it stay in there forever? You said it dissolves.
It dissolves, actually we program it depending on injury. Acute injuries, we only need it to stay in there for about really 3 weeks, so we program it to last 6.
So bottom line, for people who are dealing with paralysis, I mean, how hopeful should they be about this? Yeah,
so for acute injuries, we expect this product to be on the market in 2013 at the end of next year, so we're really excited about that. And then for the chronic injury, we're working with cell partners, and we need those cell technologies to advance. We did just hire the director of regenerative medicine from Geron. He's now our chief science officer, and he's been running the only human embryonic stem cell study in the world. So we're excited to bring his skill sets into our team to create regeneration technologies for the chronic population.
Well, it is pretty remarkable to see, your example here of the monkey, and so, it would be great if this would work for humans, so we shall see. Thanks for coming in with the explanation. We appreciate it.
We've treated over 40 monkeys, and all of them run in about 3 weeks, so we're pretty excited about it.
Every single one of them?
Oh, yeah, definitely.
How about that? Yeah. All right, well, listen, for more information, we're going to link you over to his info on our website, fox2now.com, so you can read and learn more about